Welcome everybody. Great that you came here, although there are a lot of other interesting presentations, so thank you for that. Today I want to tell you something about the Masterclass openEHR and the Masterclass as a transition to healthcare and social care. So, with the Masterclass we have a lot of added value, and I want to show you in the next slides something about that. So it's a product to gain knowledge, but also this knowledge will lead to better decision making. You can exchange experiences, learn from each other. I think that's very important because everywhere is something developing, so it's good to know who are the front runners, what can we learn from them. And you also can experience the actual needs in the market. What are the people talking about? What are their problems? And how can we solve that together? I think that's very important. And you can create your own network. My name is Jan de Lange. My background is I have education as a physiotherapist, and after that I moved to the industry, so medical industry. But I met Jan Witterings, a friend of mine, and he is anesthesiologist in a hospital in the Netherlands, a large hospital in the Netherlands, and we were thinking about how can we improve digital innovation. And therefore we built a small company called eForze, and we visited some international conferences to learn what is happening in the world. And we saw a lot of nice things happening in the UK. It was 2018 that time. And we saw also good things developing in the Nordics and also in Slovenia. So we thought, okay, let's do something with that. But when we came back with these ideas, these thoughts, we built up some relationships with these companies, innovative companies. We came back in the Netherlands and we find a lot of silos, and they were standing just between us and the new innovation. So we thought we have to find an opener here. So we were looking for the opener, and then we saw openEHR. openEHR in the Nordics, openEHR in Slovenia, and we thought, okay, that's very important. So when we this one first, we came with the good ideas to the Netherlands about openEHR, and we tried to talk to the people in the boards of hospitals, of companies, of insurers, and nobody know anything about openEHR. So it was everybody was looking for a solution to get all the data out of the silos, but nobody knew where to look and where to find. Although we had two companies in the Netherlands, they had openEHR products in more than 2,000 institutions, health institutions, but they didn't tell that openEHR was under the hood, so nobody knew anything about openEHR. So we thought, okay, we have to work on that, and we have to create awareness and knowledge. And at that time, it was COVID time, I came in contact with Hannah through internet, and Hannah was already working with Rosaldo on an education program online. So we discussed a lot, and we decided to start a collaboration together, and we started the Masterclass openEHR. So the company is eForze, and we are cooperating with Rosaldo of Hannah. We use the courses of Hannah, we use as a solid, how do you say that, a solid basement, a solid foundation to build on. So we have these courses on online education program. You can download it, it's built in modules, and you can learn on your own pace. It's 24/7, you can ask Hannah any question, and what's special is you can also communicate with each other. So it's kind of a educational program where we stimulate to exchange experiences. So we have this awareness course, technical course. We are now, in January, we have a new technical course based on open source platform Airbase. We have clinical decision support, which is built together with Cambio, and we have the clinical modeling. It's introduction, and it's not on the slide. I see introduction and advanced, so two courses, and they were built up together with Fresh Air with Eileen Mengiko. But next to these courses, we also started to combine it with webinars. So we say, okay, if somebody starts the course, it's about 3 to 4 months. They are learning on their own pace. We combine it with 3 webinars, one as kickoff, one midterm, and one closing. And there are always 3 presentations of about half an hour, followed by a live discussion. This live discussion is moderated by Hannah, so we really have a good discussion going on. And we like to give, with the courses together with the webinars, we like to create a bigger picture and to stimulate people to work together, to learn together, and to transform together. So we have this bigger picture. We use, we invite a lot of renowned speakers. You can see most of them. So it's really people that are changing the interoperability, the data availability in Europe and in the world. And they tell something about a topic which is very actual. And in that way, we can give our attendees the bigger picture and what's going on in the world, what's going on in Europe, and what can we learn from each other. We started with Masterclass Netherlands. That was the first one. That was 2022. And in the meantime, we had developed Masterclass Germany, Masterclass Nordics, and International Masterclass. And at this moment, we have more than 40 nationalities that followed our Masterclass, and still growing. That's not. I missed 2 slides, but okay. What I will tell you, try to tell you. At one side, we try to give a picture of all regions in the world and in Europe where we have the best practices. So, for instance, this morning we heard about One London, we have Catalonia, we have Heimat in Germany. We have a lot of developments that are very interesting to know about. And on the other hand, we also create some insight in who are the vendors, who is bringing some products or services to the market. Because a lot of people, they don't know about openEHR. They start the masterclass, they learn about openEHR, they go back to their organization, and you get a lot of discussions in these organizations. And then they decide, let's make a step towards openEHR, towards data availability. And at that moment, it's very difficult to find who is offering something. How can I make my first step? What do I have to do? So they come to me, and I think, or to us, and I think it's important to give this market view, who is delivering the products and the services. That wasn't that 2 slides. That okay, I give you some examples of masterclasses, the webinars. So here we have Vesa Jomanainen from the Ministry of Health and Social Affairs in Finland. He was talking about how they do it in Finland. We had Ernst & Young, Alexander Rosen, who was telling about healthcare data within the Nordics, opportunities and challenges. And the third one was looking from the European view, EHDS, and it was Jérôme de Barros who was telling about EHDS and where we're going to and what does it implicate. So we try to give a broader view to learn more. Oh. I missed 2 slides again, so I try to. This is an example. We had Graham Grieve in one of the webinars, and he was very open. He was asking for more collaboration with the openEHR community, and he gave a perfect pass which we cannot miss. So he stretched out his hand, and a lot of people are working on it now. So we are working on openEHR and FHIR, openEHR and OMOP, openEHR and FHIR and OMOP. So I think we have to solve this problem together, and it's important that our students, attendees know that what's happening in the world and where are we going to. It's a problem that I miss some examples. Sorry for that, but I sent over the presentation and some were left out. This is an example of the discussion afterwards. So after 3 presentations each time, we have a discussion moderated by Hannah, and we have the speakers, and also all the attendees can participate in the discussion. So we get very lively discussions about what's happening, what's going on, the questions that people have, and is also creating some community in this. I hope the next one is there. Yeah, but I missed that. Okay, there are some problems with the presentation. I'm sorry for that. Here was a certification. So people that followed our Masterclass will get a certification, an official openEHR international certification. So the people can show that they really have some knowledge built on openEHR. And I think it's getting more and more important because we get more and more tenders where companies are asking for openEHR. And so in this way, persons, so individuals, but also companies can show the added value that they are really educated on openEHR, which is important, of course. And what we experienced is that the communication between the peers is essential. So they can, during this course, they can talk to each other, ask questions to Hannah. And we also experienced that there is a good mix of people. We have, for instance, a Dutch Masterclass had 45 participants, but it were physicians, it were insurers, it were consultants, IT architects, researchers. So every role was represented in this classroom. And you get a lot of interesting discussions. And afterwards also they took it back to their organization, and there was the discussion as well. So in this way it became a transformation tool in those organizations. So the concept is a e-learning environment. So you have the possibility to ask and to discuss with your peers, but also with the educator, the renowned educator. We try to give the big picture of openEHR evolving in the market, European and world market. No pre-education is necessary. You can start with awareness course, so everybody can start there as a start, and from there you can go deeper into the material. And yeah, we have the 3 webinars: kickoff, midterm, and closing. We create awareness, we create in this way knowledge, so people can make the right decisions, and we create ambassadors. And I think that's also very important, because in the first Masterclass we had a student. He was from the Dutch insurance company, health insurance company. He became very enthusiastic about openEHR and the possibilities about openEHR. And he is now kind of a forerunner in the Dutch society of data availability. The Dutch insurers, they have a role in where the money from the government is going to the regions. And the regions have to present their plans to the health insurers, and they decide and they give advice where to go. So with this kind of ambassadors, they will tell the regions that there is a solution with openEHR, and they have to look at that first before they decide what to do. And they can decide if this region will get money from the government or not. So they are pushing in this way, they are pushing the regions and they are pushing collaboration in the regions. And for good collaboration, you need open air and fire. So we are looking to some future steps. We have monthly webinars. We start in next year with monthly webinars. So best practices, new developments, everything what is new, we will give the stage to so that people can know about it. We will focus on AI in healthcare. So that's very important. And for good AI, you need good data. And you become good data using openEHR as a CDR. And we also will focus on European health data space. It's now starting up, the European data space. It will be signed, I think, in a few months. Then in January, the first steps will be made. And then in 2 years, people or companies have to show that they are really working on it. So I think that's good, but it's very difficult to see what's happening really. So we decided to help to get to create clarity on the European health data space involvement. Okay, sorry, there was some things in the slides there. We also now, because some companies are asking, can you help us? They are confronted with tenders where openEHR is put in as a request. So they ask, how can you inform our organization in the short term about openEHR, and how can we make steps in that way? Because they are afraid they missed the boat. And so that's something we are focusing on now. We also have company masterclasses. So if there is a company, for instance, it's a consulting company, very famous. They want to learn more about openEHR, but they don't want to let the world know that they are not informed about openEHR. So they can ask for in-company training, so nobody will know that they were a little bit behind, and we help them to come into the front again. We're also looking for masterclasses, especially for healthcare managers, because they are afraid going into the technical details. So we have to help them with added value in the short term, in a short presentation. It won't take too much time for them, but they have to realize that openEHR is needed. One other thing is building the best teams, because if we have the knowledge about openEHR and you know that you need it, you need also good teams to implement it. And I think there a lot is going wrong. And we are now working on a collaboration that it's important, and Google did a lot of research on how to build a good team. And they find out that most important is a psychological safe environment to create that. And from there people are working better than having a good boss and he's telling what to do. So I think that's also important. It's also a part of this transformation. And then we start with newsletters and a community platform, because as I told, people follow the course, go back to their organization, and there come a lot of questions. Now, for instance, companies are asking, do you know people that are educated in openEHR? Because they need somebody in their company to work on the standards. And I also get questions from people that followed our courses. Do you have a nice employer where I can develop my skills? So I think it's very important to connect people that they can learn together, but also work together and transform together. One thing we are also doing is creating a live masterclass on conferences. So this was in June in Maastricht. We had 5 companies, like Code24, Marsing and Van Zijn, mental health organization in the Netherlands, Vita Group, Ernst & Young, it was Erik Vermeulen, and Usoft, low-code company. They were presenting after each other, but the red line was openEHR. So they explained how openEHR is good for all the companies. So this is more or less a live version of the masterclass, but then on a conference. And we are now asked in January 28, 29 and 30, so one day before Berlin, we are asked to organize for ICT and Health World Conference in Maastricht again. It's in the backyard of the Maastricht University Hospital, and we are asked to organize together with the Maastricht University Hospital for 3 days to organize 12 sessions about openEHR. So we are now looking into that and working on it, and we try to concentrate. We have 4 presentations each day. The first day we will concentrate on the managers. How can we give the managers the added value of openEHR together with FIRE and OMOP. The second day we have best practices, and the third day we have this marketplace. Where can you find products and services, and how can you make your first step, and how can you make a route plan. So added value is gaining knowledge, and you need this knowledge for decision making, exchange experiences and learn from each other, and I think we have to do it all together, and doing this all together you create your own valuable network. So when you work together, it's very easy to call or to mail somebody you worked with in this masterclass, and you get much easier contacts and build your own network. It's also interesting for vendors and for consultancy companies, because in this masterclass you can build up relations with the other attendees, and so that could be stakeholders, but also potential customers or even existing customers. You will find sometimes people from decision-making units in there, but very sure influencers. And yeah, you can work on this vendor-neutral open data platform community. So it gives you a lot of opportunities. So I'm ended here. So sorry for that. A few slides are missing. They were more to show what is happening. Do you have some questions at the moment? Yes.
Yeah, I'm representing healthcare region in Sweden, and I think that if I should sell in this, I have tried selling in masterclasses.
Yes.
The people that are already convinced say yes, this is interesting.
Mm-hmm.
But the ones that should really go attend to these masterclasses, i.e. the IT department, they totally refuse to listen. We are not interested, that's not for us, we should not do that. How do we get them interested? Because I can sit here thinking that this is really good, but how do I make the right people listen? They won't even come to this first session.
Yeah. Mm-hmm. That's very difficult, of course.
Yeah.
Maybe we can organize a demo for this group. If you have some departments, we could organize a demo to show them the real added value, and also maybe.
They say no to attend those demos.
No. And what about the best practices? Because you see a lot of things happening. It must be interesting for them, but no. Maybe
try
Stefan.
To force them into it.
Can I ask you if you know something?
What is the same problem in Germany? The ones that attend the conference, the masterclass, are the ones that are interested in openEHR.
Mm-hmm.
So we have no solution for this right now. The exchange, the discussions at the end of each masterclass are very interesting, and I'm trying to convince these ones with these discussions. But as I said, it's very difficult. They won't listen.
It's a kind of strange comfort to know that it's not only Swedish problem.
Yeah, Hanna.
Yeah, I think that ambassadors, they are very important. So when people start talking about these things, and what I also think is that we need to have clinical ambassadors, because if the clinicians, if they say, wow, this is good, then people listen too. So I think that in order to get open-air spreading, we need the clinicians. But we also need to build awareness across the whole community. So it cannot be the techie team, it cannot be the informaticians modeling team only. When I came into this open-air community, it was something like 2016, 17. I thought, oh boy, this is difficult. This is really complex. People talk about techie things, modeling things. They don't really talk about like we should to normal people. Because we cannot get the financing for open-air-based projects if we have only the IT people understanding, or in your case, even not the IT people. We need to get the managers understand. Managers of the regions, but also managers of the companies. And tomorrow I'm going to talk about the Nordic industry, because the Nordic industry understood that open-air is important, and that was boosting the development.
Okay, thank you. Is there any other question? Then I want to say that the full presentation is available. So if you are interested, I can send you the full presentation.
Thank you.
Yes.